All right. Hello, everyone. We are going to get started. Thank you for joining me for this month's well-being webinar. We're going to be talking about chronic conditions 101, focusing on the gastrointestinal system. If I have not had the chance to meet you or introduce myself, my name is Nurse Jordyn. I am one of our registered nurses on the staff at Kinetiq Health. So I'm excited to dive into this topic with you today. It's actually pretty near and dear to my heart. We have a lot of information to cover, so let's get started. To start off for webinar housekeeping, the big things to know on this slide is that all attendees will be in listen only mode for the duration of the webinar, meaning your mic will be muted. But if you have any questions or comments, please use the chat box located in the right-hand side of your webinar screen. Lastly, today's presentation slides and resources can be downloaded by clicking the paper icon on the right-hand side of your webinar screen. Like I said, we have a lot of information we're going to cover today, talking about the statistics and prevalence of GI conditions in our population today. We'll take it back just for a couple of minutes to review the pathophysiology of the GI tract, and then talk about the different conditions that can affect our GI tract. We'll then talk about how to best navigate the healthcare world by going to appointments, disease management, and different methods of support if you or a loved one is dealing with a digestive disease. So to start out with the prevalence of GI conditions in our society, more than 60 million people in the US are affected by a GI condition, with about a third of those, 20 million people, suffering from a chronic digestive disease. So this is if someone is dealing with something over months or years at a time. Now, nearly 60% of American employees who experience GI issues at least a few times a month or who have a GI diagnosis have missed work, left early, or come into work late. So we know that these conditions can be very all-encompassing and affect a lot of different parts of people's lives. More Americans are hospitalized with a digestive disease than any other condition. It's actually the top reason for ER visits, with about 8.3 million visits annually. And lastly, surgeries, when it comes to those digestive conditions, account for about 25% of all surgeries. So we know that this is a very prevalent issue in our society today. Now, like I said, we're going to take it back to nursing school for me for just about 2 minutes, so bear with me here. We're just going to talk about the basics of the GI system, because we know that if you have an understanding of how the GI tract is supposed to work, it helps us to understand the disease progression and conditions when it does not work properly. So we know that altogether, the GI tract is an important organ and muscle. It's responsible for digestion, breaking down our food into nutritional building blocks so that we can use it for energy. So you can see in this diagram that we have all these different parts of the GI tract. We see that you have the mouth, so when you take a bite of food and it's mixed with saliva, that begins the digestion process. You then have food go through your pharynx into your esophagus, and that is then pushing food into your stomach. Your stomach is then connected to a number of different organs, including the gallbladder, the pancreas, and the liver. All really important organs that break down different specific aspects of our food. But a big focus for our discussion today is going to be the small intestine and the large intestine. The small intestine is going to be where a majority of digestion is. It's broken into 3 different parts. You don't need to commit this to memory, but I just want you to be familiar with these terms, because when we talk about digestive diseases and where it affects the body, this will be helpful to know. So 3 parts of the small intestine: the duodenum, the jejunum, and the ileum. And then this then leads into the large intestine. This is actually where we have a majority of the processing of water and salt. So hydration mainly happens in the large intestine. And this is also broken up into a few different parts, but the main thing you need to know that is in your large intestine is your colon. So then when we're talking about GI conditions, we know that these are broken into two different categories. We're going to talk about functional GI conditions and structural GI conditions. So let's start with the functional. Functional GI conditions are going to be when someone is experiencing uncomfortable symptoms, like you see what's listed on the screen. And it's going to be due to GI irritation, but your provider can't see any physical or structural issues with your GI tract. So these diagnoses can be kind of frustrating because you're experiencing symptoms, but you can't see the physical reasoning behind it. So things that fall under functional GI disorders include things like cyclical vomiting, infant colic, functional heartburn, or dyspepsia. You may have heard of IBS, which is irritable bowel syndrome. This is just going to be when your muscles are contracting more or less often than they should. Or there's also something called SIBO, and this is just short for small intestinal bacterial overgrowth. All that to say, it's a little complicated, but it's essentially just when your small intestine has way too much bacteria and it's inhibiting your normal digestion. So you might experience a little more gas pain with this diagnosis. Now, causes for functional diseases are usually, not always, but usually a little more easy to pinpoint. This can be due to changes in dietary habits. Maybe you are on vacation, you're taking in more highly processed food or deep fried food, less whole food, and so we may not getting enough fiber. So changes in dietary habits can cause some functional GI disorders. Exercising, we know, does affect our GI tract and our digestion. So if we aren't doing any consistent physical activity, we might have issues with our digestion. We do know that the mind and the gut do have a connection. So any stress or anxiety can affect your GI tract. Think about times when maybe you've been excited about something and had butterflies, or you've been stressed about something and felt nauseous. We know that these do connect. So any stress or anxiety can affect that as well. Hormonal changes, unfortunately, specifically for us women, we can see with pregnancy and menopause that we experience some GI distress. And then lastly, if you have any food sensitivities, things like gluten, dairy ingestion, all can cause some of these functional GI issues. But structural GI conditions are a little different. So GI conditions that can be structural abnormalities, they're attributed to these. So it's going to be blockages, inflammation that are all seen upon examination. Now, I do want to recognize that this list is not an all-inclusive list of structural GI conditions, but these are probably the most common structural GI tract disorders that we see in the healthcare world. So some of them you may have heard of before, things like hemorrhoids. This is going to be when you have swollen veins around the anus or rectum and have pain and bleeding upon having a bowel movement. These can be really uncomfortable. Acid reflux, or you may have heard of this as GERD. This is going to be when someone has stomach acid that goes back up into their esophagus, and they can experience some pretty uncomfortable symptoms and burning in the throat. Gastritis or gastroenteritis, they're pretty interchangeable, but this is going to be inflammation of the stomach or the intestines. Now, this is a structural disorder that actually a lot of people have dealt with at some point. It can be a little more acute because it can be due to things like the flu or food poisoning, things like that cyclical vomiting that can start as a functional disorder. If it lasts for long enough, can lead to that inflammation in the stomach. Diverticular disease and diverticulitis. This is going to be when there are pouches in the large intestine that form, and we might see that gastric contents can build up into those pouches. And if those gastric contents do not clear out of those pouches, we see infection form, and that is when someone is diagnosed with diverticulitis. So that will be something the doctor talks through of maybe considering fiber supplements or antibiotics to take care of those infections. Irritable bowel disease, that is what IBD stands for on the screen. We're actually going to dive into a little more specifics on this on the next slide because these conditions are a little more complex. And then colon polyps and colon cancer. Unfortunately, we know that colon cancer is one of the most common cancers in the US, and individuals who have a history of polyps have an increased risk of developing colon cancer. So this is something we want to make sure we are connected with a gastroenterologist on if we need to have routine screenings for that. So like I said, we're going to go through irritable bowel disease a little more specifically. This affects about 1.6 million people in the US, most commonly kind of on the younger side, from 15 to 35 years old. So we know that there are pretty vague signs and symptoms that can happen with GI conditions, but when we get to irritable bowel disease, it gets a little more specific. So people can experience unintended weight loss, diarrhea, blood and stool, and moderate to severe abdominal pain. So Crohn's disease, you may have heard of, but to bring more specifics of what that disease is, it's a autoimmune condition. So that's going to be when the body is attacking itself that causes the entire digestive tract to become swollen and irritated. So this can be a very painful disease. Ulcerative colitis is a little more focused on one area of the GI tract in the colon, and it is a lifelong condition of inflammation and ulcers that can develop in here. Both of these can be really serious in general, but especially if they are not managed properly and can cause things like perforation, severe bleeding, dehydration. They can even lead to liver concerns as well as having an increased risk of colon cancer. So as we go through all these disease processes, as you hear this, you can recognize that patients with GI conditions can feel really all consumed with their symptoms. They can feel isolated. This is a really difficult thing to be dealing with. And one of the most difficult things I would say for GI conditions and patients with them is that it can take months to even years to get a diagnosis of a GI condition. So it's really important to establish a really good a relationship with a primary care provider. So you can have open conversations about these symptoms that you're experiencing. So on the screen here, you can see a list of things that are really appropriate to speak to your primary care provider about. Things like changes in bowel habits. Maybe if you're noticing your stool look kind of different, if you're having more or less than you used to. Any blood in your stool is definitely a cause of concern and something to reach out to your primary care provider about. If you're having persistent, unusual abdominal pain or gas pain, reach out to your provider, as well as, like we talked about before, unintentional weight loss, unexplained weight loss. That's going to be an indicator that there might be something going on in our GI tract we need to discuss and know about. And then lastly, nausea, vomiting, or constant fatigue. Talk to your primary care provider about. I unfortunately have a number of friends and family that have dealt with diagnoses in the GI realm, all the way from celiac disease to Crohn's disease and IBS. So I can acknowledge that they were able to get diagnoses a lot quicker when they had these types of conversations with their doctors on the earlier side. So when you go to the doctor, they might order a number of tests. One of those would be including lab tests, taking a look at your WBC, which is your white blood cell count, and your RBC, which is your red blood cell count. If your WBC is increased, you might be experiencing some inflammation or infection. And then if your RBCs are decreased, this might indicate anemia, which is pretty common with Crohn's disease and ulcerative colitis. They may order a stool sample. So they'll take a sample of your stool and check it for any bacteria, parasites, or blood, all three of which would be a cause for concern and warrant treatment. Upper or lower GI series. So this is going to be things that you may have heard of, like endoscopies and colonoscopies. These take a look at your GI tract in different ways. The endoscopy is an upper series where they take a look at your throat and the start of your small intestine by going through your mouth. You're under sedation for this, of course. And then colonoscopy is when they will go up and look through your colon and your small bowel that way as well. In the last decade or so, they've also come a long way with capsules that have little video cameras in them that you can ingest, and it actually takes an entire video of your GI tract. So that can be really helpful with identifying GI diseases as well. And then lastly, providers can do ultrasounds, CAT scans, and MRI scans to take a look at inflammation in a non-invasive way. Now, before we get into going to a gastroenterologist and treatments, I want to make sure it is acknowledged that for any GI condition, treatment is going to be extremely individualized. So it is so important to work closely with a gastroenterologist and or a registered dietitian who specifically works with GI disorders, because we know that things that we ingest, the food that we take in, may exacerbate the symptoms we're experiencing. So having a well-rounded care team to walk through this medical journey with is going to be extremely, extremely important. So please know that this is going to be very individualized. Now we know that when you are referred to a gastroenterologist, unfortunately, there usually are waiting lists that can be months to even up to a year long. So time with them is extremely important. And so this slide is meant to give you some things to make that conversation as productive as humanly possible. So things to bring when you go to the doctor. We'll get in a little more detail on what a symptom log is on the next slide. But for the sake of this slide, a symptom log is going to be noting timing of when you may experience triggers or exacerbation of symptoms when it comes to your GI condition. Maybe you eat something specific and that's when you experience abdominal pain, or you have abdominal pain right when you wake up, but not at night. All those things are going to be helpful to bring to your provider to help guide your conversation. A list of medications, supplements, and diet changes you've already tried is going to be helpful, as well as any recent lab results or imaging, especially if your gastroenterologist is at a different hospital system than maybe you got your labs or imaging done at. Having that readily available is going to be pretty helpful. Now, if you've already received a diagnosis, you may have a lot of questions that have come up since you received that. The biggest thing I encourage patients to do is to first understand what you've been diagnosed with. Unfortunately, us medical professionals can get caught up when we're trying to explain something and may use a lot more medical jargon than we realize as we're discussing things. So if you hear a lot of medical jargon that maybe you don't understand, I encourage you to stop the provider. It's okay. And to ask them to explain things in a little more layman's terms, just so, again, you understand what you're being diagnosed with. So ask questions about your condition. Ask them about what symptoms, things that may exacerbate those, things maybe you should avoid or limit to help with any type of pain or discomfort you are experiencing. What local resources are available for support? Again, like we kind of already talked about, we know that GI conditions can be extremely isolating and frustrating and all-encompassing. So it's so helpful to find a community, whether that's through the hospital system, whether that's through your doctor, or even a Facebook group of people that have the same condition and are walking through similar scenarios as you are. It just helps you to feel a little more seen and not alone through this medical journey. And lastly, what treatment options are available, which we're about to discuss. But as you're discussing your specific treatment options with your doctor, talk about what medications they may recommend, or if there are alternatives that could be taken over the counter, as well as any treatments that may be specifically helpful for you, whether that's a surgery or any other type of specific dietary or lifestyle modification. So to start out with functional GI concerns, these are going to be interventions that correlate with functional GI conditions. So first off, your doctor may ask you to examine your intake of fiber. Maybe you're getting too much, or maybe you're not getting enough. But a doctor will help guide you as far as how many whole foods you should be eating and adjusting your dietary needs. To avoid food or environmental triggers. Now, again, this is going to be difficult to do if you haven't identified what exacerbates your particular symptoms. So that's why it can be really helpful to work with a registered dietitian that's specialized in GI disorders. But to start off and get you started, food journals are basically a detailed record of what you eat and drink throughout the day, and then noting if you're having any stress, emotions, symptoms, whether that's bloating or pain related to those foods that you're ingesting. And this can just be really helpful to identify what's exacerbating those symptoms. There's also something that you may have heard of called the FODMAP diet. Now, this is a temporary diet that is meant to restrict a certain carbohydrate called a FODMAP. These carbohydrates may cause a little more intestinal distress and are harder for our bodies to digest. So when we temporarily remove them, it actually allows our stomachs to regenerate its lining and bacterial growth that's healthy. And so then as we reintroduce those different types of carbohydrates, we can identify maybe what we have an intolerance for. Now, I want to emphasize with a FODMAP diet, again, this is temporary and very restrictive. So please, again, make sure you're connected with a gastroenterologist and or registered dietitian before you engage in this diet. Physical activity, we kind of already discussed, but again, looking at this and if you're not having enough, how this may be affecting your digestion. And then lastly, your doctor may talk about medications if any of the interventions that you have done have not helped with symptom relief. Now, unlike functional GI disorders, structural GI disorders don't often get better with lifestyle changes alone. So we often need some type of medical intervention, whether that's a specialist appointment, medications, even surgery at times. But you can see on this slide, we have a variety of different categories of medications. A lot of them are focused on controlling your inflammation or your body's immune response. Things like those aminosalicylates, steroids, and biologics. Antidiarrheal medications may be prescribed as long as a bacterial infection or a parasite has been ruled out. If your body is trying to clear something out, they may not prescribe these. So that's something to be aware of. Immunosuppressants may be prescribed if the doctor is trying to calm down your body's immune response. And then biologics. So these are going to usually be reserved for individuals with ulcerative colitis or Crohn's disease that's in a moderate to severe spot. So these are going to be those medications like Stelara, Humira, Entyvio, Remicade. This is going to be, again, reserved for those times when other interventions have not helped relieve your symptoms. And then lastly, you may have seen commercials or heard of the medication Rinvoq. This is one of the more popular medications under the class of medications JAK inhibitors, just a specific type of chemical that triggers inflammation that this medication works to inhibit. But sometimes if medications and supportive treatments aren't working, surgery may be considered, and it can be minor to major surgery depending on your GI concern. Things like hemorrhoids may need to be surgically removed. With GERD and any reflux, there may need to be some surgery on the sphincters around your stomach. Or diverticulitis, they may need to remove the pouches out of your large intestine altogether if other medications are not helping to remove those symptoms you're experiencing. But unfortunately, when it comes to Crohn's and ulcerative colitis, up to about a third of people may need surgery at some point. And this, again, varies on patients. But if you have an area of your bowel that is not getting better, even with biologics or JAK inhibitors, a surgery that is either temporary or permanent may be warranted. And it's definitely a conversation to have with your provider. Now, as we've discussed today, there's a lot that goes into GI conditions. And when you are a patient dealing with those GI conditions, it can feel like a lot. So first of all, have grace with yourself, educate yourself on what is going to be best for your body, whether that's certain diets or avoiding certain foods or living a certain way to help improve your quality of life. Make sure you're asking those questions to your doctor to assist with that entire process for yourself. And then talking about managing stress, we talked about that a little bit earlier, but we know that stress can trigger both IBS and IBD symptoms. So if you find that maybe you're in a stressful or anxious situation, or just in general, you want to talk to your provider about maybe getting a referral for a behavioral health specialist so that you can manage your stress in day-to-day life, this can really help to improve your gut health in the long run. Support, we've talked about this already, but again, making sure you're getting connected with groups that help you to feel not alone and know you're not alone, so that you can be supported in that way. And lastly, pack an emergency kit. This may seem a little overkill, but it can help to alleviate anxiety if you are far from home, maybe out with friends. Having an emergency kit just in case can be helpful. So things, maybe if you need change of clothes or pads or supportive medications if you were to experience an exacerbation of your symptoms while you're out. This can be helpful to have in your purse or your car. And lastly, if you are someone who is trying to support a loved one with a diagnosis, it's important to educate yourself and understand what they're going through, understanding just how difficult this is right now. It's helpful to listen to them and empathize with them. They may not outright say what they need, but actively listening to them and anticipating maybe if it would be helpful to cook a meal for them that's going to be nice on their stomach. That could be helpful. Another thing is avoid toxic positivity. Things like, oh, but it could be worse. That is not going to be helpful to any patient going through a chronic GI condition, really to anyone going through a chronic condition. So it's important to sit with them in difficult moments and situations to help them feel seen and known. And lastly, support and advocate during appointments and treatments. I can speak to the number of people that I know that were able to get the diagnoses that they needed was because of a friend or a loved one sitting with them in these appointments and advocating for them. I have a family member who actually was pretty young when they were diagnosed with Crohn's disease. They were getting unexplainable weight loss. They were experiencing a lot of diarrhea, and they kept going to the doctor, and the doctor was like, oh, it's probably just a bug. It just needs to clear out. But after about the third or fourth appointment, this individual's family member was like, I don't think that's what's going on. And because of that family member advocating for them, this person was able to get their Crohn's diagnosis within about a month, which is usually pretty unheard of. So again, the importance of supporting and advocating for your loved ones during these treatments and appointments is so, so important. So that is all the information I have for you guys. I know it was a lot to take in. There's a lot to take in with GI disorders, but this is where I got a lot of my information from. And I would be happy to connect with you guys if you have any questions or concerns. I know we may have a minute or two here to review if someone has submitted anything in the chat boxes. But otherwise, if you want to email me with any questions or concerns you may have, my email is provided on the screen. As we're waiting for any comments or questions to come in, I do want to acknowledge we have our next monthly well-being webinar in August on the 26th. This is going to be focused on the basics of life and voluntary life insurance. So be sure to mark your calendars and get in tune for that. All right, sounds good. Well, it sounds like we have no questions at this time. Again, feel free to send an email if you want to correspond with me in that way. But otherwise, we will see you in August. Have a great afternoon.